The only thing worse than having to go to the emergency room, of course, is to have wait hours and hours when you get there. Yeah. But I understand there is a new website now, to help change all of that for patients who come in.
Certainly when you go, it can almost feel interminable, the number of hours you have to wait. Now, there is a website now for a certain hospital that lets people know how long they'll have to wait, but it also lets people know the other places they can go for care if they don't want to wait that long. So far, it appears more people are now skipping the emergency department and using other facilities like urgent care instead.
Debbie Normore considers herself lucky. She's hardly had to wait at the emergency department, but she could have actually checked the wait time online before she left home.
I think it's a really good idea. So many people show up at the hospital anticipating 4, 5, 6 hour waits. This is great.
St. Mary's in Kitchener-Waterloo is the first Ontario hospital to implement a wait times website created by a company called Oculus.
It provides information on the number of patients that are currently in the emergency department. Then we also provide the estimated average time that a patient will have to wait.
The system's level of accuracy is said to be 90%.
The patient that comes into the emergency department, there's a 90% chance that they will be seen within the time that is posted.
The system is intended for what are called level 4 and 5 patients, people with issues like flu, stomach aches, and cuts. After 4 months, the hospital is seeing some shifts.
What we've seen in June and July is a marked decrease in the number of CTAS 4 and 5 patients that are coming. And we're actually also seeing a bit of a shift in those patients as to when they come.
Nurse practitioner Landon West says patients tell him knowing what the wait time might be allows them to better make a decision about their own care.
If they feel it's something that can wait, or that they can go to an urgent care clinic, walk-in clinic, their family doctor, or call telehealth, they have that information right there on the website.
Others say there may be a downside.
If even one person looks at one of these apps and makes an unfortunate decision to delay their care as a result, I think that's a tragedy that we can avoid. And of course, the person who should decide how urgent that patient's problem is the triage nurse when they arrive at the emergency department.
Hotel Gia Grace in Windsor will be using Oculus as part of a pilot project in November, and some 19 hospitals in Ontario have expressed interest in the system. St. Mary's plans to do surveys with the emergency department patients to see if they like the system, as well as check with other facilities in the area to measure how many patients decided to go and use those resources instead, because their volume of those patients with colds and flu and that sort of thing has actually been reduced.
Okay, so when we talk about wait times in ERs, generally speaking, how long do patients wait?
New statistics are telling us that the wait times in ERs have actually been reduced by about 20 to 25%. So on average, in Ontario, any patient at any hospital would probably wait at an average of about 3 hours.
3 hours, which is a big improvement, because we used to talk about 6 and 8 hours, but still too many patients are ending up in ERs when they can be cared for by other types of care.
Exactly. It's a question of access to that care.
Yes, that's right. That's always the tricky one, isn't it, Bea? Thank you.